Good afternoon, and welcome to today's Inclusion Works Community Advisory Committee meeting. Before we get started, here are a few reminders about the webinar. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call, unless you're speaking or asking questions. To ask questions, use the Q&A feature located on your control panel, and we will answer as many questions as time allows toward the end of the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Stillman Bridges and Susan King Lanier. For closed captioning options, select the closed caption feature located on your control panel. To adjust your video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics are overview and updates, workforce training North Carolina, provider innovation and training, the Employment and Independence for People with Disabilities program, and employment assessment. At this time, I'd like to turn it over to Claire Colligan, IDD Employment Lead for the IDD, TBI, and Olmsted section of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you so much, Latoya. Welcome, everyone. It's wonderful to see the attendance, so many people coming to this quarterly meeting so that we can speak to all of you about the great work that is happening with Inclusion Works and the giant strides we continue to try to make for people with disabilities in North Carolina who are choosing to work. Next slide, please. So today with me, I have Catherine Titus. Catherine is the Senior Technical Assistance and Training Manager at WISE, and they have been a huge partner for us, working together in the area of staff development and training, as well as provider innovation. And Anita McMahon, I believe, is not here today, but in her place, we have the stellar Adrienne Kittle, who is the Program Specialist for Employment at EIPD. And we have Brianne Tomaszewski, who is the lead investigator on the contract for Work Together NC and North Carolina's, North Carolina's intellectual and developmental disabilities employment work. So we are very appreciative of everybody who's here today. We also have Barbara Bussin, and Barbara has recently joined us here at Inclusion Works, and Barbara is the Propel Project Site Coordinator, Intervention Coach. She has already made a great difference, and we're very happy to welcome her to this team. Next slide. So today we're going to do a few of our usual things. We're going to go over a little bit about some of the things that we're working on here in North Carolina, how our work has been syncing up with the strategic plan, the 5-year strategic plan that we are incredibly coming up on a year of implementation. We're going to give you a little bit of overview on our provider innovation and training programs, and also talk with EIPD about the great work that is happening as part of Inclusion Works from that division of state government. We're going to give you an update on the employment assessments, and we're going to continue to share information and ask for your feedback on the work that we're doing, and hopefully be able to take your feedback and bring it back to the project and continue the work that we're doing. Next slide. So just a few updates, just some reminders about what this meeting is and why we're here. Next slide. This is a forum. This is for people who have lived experience, their families, their providers, their advocates, to share their thoughts and perspectives. We want people's opinions about the Inclusion Works program. We continue to monitor and adapt the work that we do based on the feedback from people with lived experience, especially. Um, we will share key updates about Inclusion Works, and we will continue to get feedback on the implementation of the program activities that we have. Next slide. So just as a reminder, these meetings occur every 3 months at 11 o'clock on the third Tuesday of the month. This is obviously our July 2026 meeting, and then we will have another meeting in October 2026, and then we will pick it up again in 2027. Hard to believe we're talking about that already. Please remember to always respond to our calendar interventions. Come prepared to talk to us. And if you don't have my email already, here it is. And please always let me know what your thoughts are. And if you need to add agenda items to this community quarterly meeting, I would love to see those as well. Next slide. So a couple of updates regarding where we've been since the last quarter. Next slide. And we have a new video which is out. It is on DHHS YouTube. When we send these slides out, you'll have the opportunity to check those links. And I think we might be putting those in the chat as well. So make sure you check that out. We're really happy with this Informed Choice video. I think it talks a lot about how we put the people that we work with and how we put people like you who attend this meeting, how we put you front and center in terms of your ability to make a choice regarding what happens in your life. We were really lucky to have Stephanie Haynes from EIPD. She was here to talk about transition services and how people can go from school to work, avoid that cliff that we always talk about, and have a smooth transition into adult and employment first as an option. On August 19th, we will have another Lunch and Learn, and this will be hosted by the providers in our provider grantee, in our provider innovation program. They have been working, so the first cohort has been working now for about a year on transforming their businesses, their agencies, and the way they support people with disabilities who want to work. And we're really excited for them to come and tell you about the work that they're doing. There'll be a registration link for that pretty soon. Next slide. So as a reminder, the folks that we're talking about that we will see in August at that Lunch and Learn are OE Enterprises, Noose Enterprises, Allegheny Group Homes, and Vocational Opportunities of Cherokee. These folks have been very hard at work, and they've done some really innovative things, and those things are turning into jobs. And as a result of the success of that program, we were able to double the number of people that we can add to this program. And so through a rigorous application process, we were able to select, and this was a reminder, this was a blind process where no one knew who they were reviewing, whose application they were reviewing, and we were able to select these 8. And we're really proud to announce that Alula, which was Transylvania Vocational Services, is now with us. Durham Exchange Club Industries, Gateway Human Services, Community Workforce Solutions, Monarch, the ARC of Davidson County, the Workshop of Davidson, and Chatham Trades. And so these guys have already been hard at work, working on their beginning onboarding work of starting to set out their goals and objectives for the coming year. So we will be giving you information back on this throughout the course of the year as they continue to do this amazing work. So next slide. Okay, a little bit of update. I just explained that the strategic plan has been in place for almost a year. And next slide. Here is a link that you can look at to check the inclusion plan if you haven't looked at it lately. The work that we have been doing has been really amazing and also interesting as we've navigated some new obstacles that we realize. All of you know there are so many challenges that pop up for people who want to work and we come up with new challenges, and then we try to work through solutions. And there are a lot of people working on the work plan for this plan. We're going to try to give you a 1 year review in the fall of 2026, so please look for that. And again, please continue. I read every email. I may not be able to respond to them all, but I am really excited to get information back from all of you, especially those of you with lived experience, and try to resolve issues that come up. And I think we've done that with some success this year. We want to be able to do more. Next slide. And so as a reminder, these are the 5 specific goals that we chose. And as a reminder as well, these goals were chosen based on a really intensive landscape assessment with a gap analysis that was conducted by Work Together NC for us. And they did a terrific job. A lot of you may have participated in interviews with them. They looked at a lot of data. They did a lot of research. And so with that in mind, we chose these 5 goals as key to making sure that we have an informed choice process in North Carolina so that when people choose to work, they get to work in settings that they desire and not only the settings that might have been available in the past. Key to this is making sure that that decision making that a person does is truly informed. We never had a standardized way of doing this across the state, and we've been rolling this out now for over a year, and we've had a lot of success. And people who take the assessments that the Work Together is doing are really showing an increase in the ability to decide whether or not they want to work. If people want to work, we have to have quality services. So we have to make sure that we're building foundations for employers, we're building foundations for people who provide services, and that we continue to reinforce and strategize and assist wherever necessary. The community, and this is one of the ways we reach you, is huge. If I don't have your feedback, if we don't know what it is that's happening out in the community, we can't possibly be effective. And we have a lot of ways, again, this is one of them, where we try to maintain contact with as many people as possible and use your feedback in an organized way. We know we have to have a solid workforce. Part of the work our provider innovation grantees are working on is building and maintaining talented, skilled workers who can help support the talented and skilled workers that we're serving. And that's just a really important part of this. Everybody plays an important part. And lastly, we want to make sure employers know we're here. Employers know that there are talented, skilled, gifted employees available to work in their jobs. And we want to make sure that they have the option and the opportunity to really find people who will work great in their facilities. Next slide. Next slide, thank you. So as we built this plan, we took these goals and we broke them down into objectives. So each goal, each of the 5 goals has specific objectives that need to be accomplished in order for us to feel that that goal has really been met. Each one of those objectives is again broken down into strategies. Our advisory committee that meets monthly, which is a really solid working group of people, again, from all areas of the employment world, including and especially people with lived experience, have worked to develop those strategies with us through the work of the monthly advisory committee. I can't say enough about how effective that group is. And then those strategies are broken down into tasks. And the implementation plan that we have is very complex. It is large, but it is really important. And we get to see where we are making progress and where we need to rethink and move things differently so that we can get some of this work done. It keeps us accountable. It keeps us focused. And as always, we ask for your help in making this happen. Next slide. Okay, so we're going to switch over now to the Work Together North Carolina assessments and how that's going. We've been at this for a little bit, and I would very happily like to turn this over to Brianne Tomaszewski.
Thank you so much, Claire. And I'm happy, as mentioned earlier, to introduce Barbara, who's going to be supporting Work Together NC's role in Inclusion Works as the new project coordinator and carrying on the great work that Yolanda Perkins has done for us over the past few years. And so Barbara is going to share some brief updates on what we've been up to as far as the employment assessments.
Thanks, Brianne. Next slide, please. So we have been working with 15 providers. We have completed employment assessments with 143 individuals with IDD. We have also worked with families and guardians and completed 57 employment assessments for family and guardians. And then looking at the teach transition assessment profiles, we've completed 10 of those. And I do just want to say that I am extremely honored to be joining you all in this journey. Next slide, please. Just looking at something that has been said and that we have as a testimonial, the team came in and met with participants, a family member, and a caregiver to ensure all assessments were completed. We are very appreciative of the wonderful assistance provided over the past 2 months in ensuring participants were assessed. Thanks for the amazing team. Next slide. I'm turning it over to Adrienne now to talk about CIE Liaison.
Good morning. My name is Adrienne Kittle, and I'm the Program Specialist for Intellectual and Developmental Disabilities with North Carolina Division of Employment and Independence for People with Disabilities. And I believe some of our CIE Liaison team members are also on this call. Donna Rice is our Program Manager, but I'm going to share a little bit of update on her behalf. If you'll go to the next slide. So as we've mentioned before, the CIE Liaison team is a collaboration between staff with EIPD and staff within the tailored plans. This joint team collects referrals from Work Together NC for individuals that express interest in services in support of competitive integrated employment following that Work Together NC assessment. So they work closely with individuals who have expressed interest in services related to CIE. The CIE liaisons are responsible for contacting those referrals, sharing information with families and individuals about employment options and the services available. They share information about the benefits of competitive integrated employment, and then get a final assessment of whether they want to pursue a referral to EIPD services. And if they do, then they provide that warm handoff to our local offices that will receive that referral and initiate an application for services. So next slide. And as part of this referral process from Work Together NC, again, we received the referrals from Work Together NC following the completion of the employment assessments. Right now, I believe we have about 46 referrals where the CIE liaison team has received those referrals. They've reached out to the individuals, family members, guardians, and those individuals have consented to taking that next step to pursue an application with EIPD. Of those 46, 26 applications have been taken, and the process has been started with EIPD to assess eligibility, and in some cases develop that individualized plan for employment so services can begin with a supported employment provider through EIPD. And so we meet bi-weekly to assign those referrals to one staff or the other within the CIE liaison team. So it may be a staff within EIPD or the CIE liaison within that tailored plan. But the collaboration is helpful. Our EIPD staff understand the local offices and who that referral needs to go to. And then the CIE coordinators with the tailored plans also have information within their system where we can share information between the agencies to coordinate those services. And a consent is signed on the front end with Work Together NC that allows this collaboration to happen. Next slide. And then I also wanted to share a little bit of information from the EIPD side of things with services, and you can move on to the next slide. I wanted to share another role that our outreach case managers play. They are now responsible for our career counseling and information and referral services. And this is a requirement under the Workforce Innovation and Opportunity Act, where employers offering sub-minimum wage to employees, those employees are required to receive this career counseling and information and referral services at certain times in the process of earning sub-minimum wage. So for adults who are 25 and over, they have to receive a career counseling session within 6 months of when they begin sub-minimum wage, and then annually thereafter. And there's some additional requirements for youth under the age of 26 or actually, I'm sorry, I think that's a typo, under the age of 25, where youth have to receive a career counseling session before they would enroll in sub-minimum wage. They also have to be determined ineligible for EIPD services before that employment can begin. But then they also have to receive a career counseling session before they begin sub-minimum wage. And then again, within 6 months, and then they're on the annual schedule after that. But the career counseling session is really about making sure that that individuals know of the choices that they have for their employment path. So we don't want to limit options to anyone, but we want to make sure that individuals who are entering sub-minimum wage also know that they have the option to pursue competitive integrated employment, and the services are available to support should they choose. And that's really the focus of the career counseling session. As part of the information and referral services, we also share information related to benefits counseling. There may be information regarding tailored plans. If individuals aren't available with services through the tailored plan, we often list that as part of the referral information, and then our contact information for the local EIPD offices. So even if somebody's not interested in services at that point in time, they have that information should they change their mind at some point and want to pursue services throughout the year. Next slide. So I also wanted to touch on a lot of work that's happened within DHHS and our partner agencies in the coordination of supported employment services. As many of you know, the EIPD is the initial primary funding source for supported employment services. So there is an expectation that individuals receive services through EIPD before that service is provided through the tailored plan and the funding that it offers. It's been a little bit of a confusing process at times between the funding sources and in the coordination of services for someone who may need that long-term support after the EIPD services are through. So we've done a lot of work as a department to make this process a little bit smoother for people, for individuals who are receiving the services, but also for our staff, our counselors, and the tailored care managers who are tasked with coordinating those services. So on the EIPD side, we're really trying to back up that communication with the tailored care manager a little bit we're backing it up further than what we did before, and really trying to think about asking the counselor to think about that coordination of services when we're developing that plan for employment and listing supported employment as a service that someone needs. So as we are listing that service on the plan, we're asking the question, is there a tailored care manager assigned? Who is it? And if there's not one, we're connecting with the tailored plan to begin that 1959 assessment. And the counselor starting to have those conversations about those long-term supports. If they're already connected with the tailored plan, who's the tailored care manager? Who are the providers that are involved? Because a challenge sometimes is that EIPD's providers may be different than the providers that are available on the tailored plan side. And so there's a need to coordinate those services if we have to hand off to a different provider agency. And certainly by the time the counselor is actually initiating that referral to our supported employment provider, we're wanting to make sure that 1959 assessment is in process or completed, so that things are ready when the time comes to hand that off. And as we initiate services, there's communication between the EIPD counselor, our supported employment provider within EIPD, and the tailored care manager to plan for those extended services. And when that job offer arises and a job is found and accepted, then that's when the closer communication has to occur, because we need to stay in communication with that tailored care manager to make sure that they're aware of when our funding may end, when our client has made progress in terms of the training goals that were identified and they're nearing completion or achievement, whatever that looks like for that individual. We need to be getting the funding in place through that tailored plan so that there's no gap between the funding sources. And so counselors now have a letter template that we're using to document that achievement of those training goals. We call that stabilization. But the idea is that we would be giving that letter to the tailored care manager in advance so they can begin the process of getting that funding approved so that can begin following our stabilization date. And so the EIPD case, it remains open. We continue to follow the individual for at least 90 days following our stabilization date. And it's after that point that we can successfully close the case. But the intent is for those tailored plan funded services to begin on day one of our 90-day count, so that there's no gap in supports that individual needs, and there's no gap in funding, so a provider can get paid for the support that they're doing. So next slide. And I think I'm going to hand it off to Brianne again to speak about the Work Together community engagement.
Yes, thank you, Adrienne. So we're happy to share some of the additional activities outside of assessments that we are working on with Inclusion Works. So next slide, please. So in addition to some of the videos that we've been working on, such as the Informed Choice video that Claire shared earlier, we've also been sharing on social media different topics that have been highlighted, that have been developed for 10 weeks, and we have more coming. And so we've had lots of views for our recent Purple Bow video, highlighting some amazing inclusive employment. Our videos often have a lot more views, and so we're planning to develop more videos. And EIPD is also partnering with us to reshare our posts, increasing engagement, and hoping for continuing to have more cross-posting to reach larger audiences. In addition, Work Together NC has developed a new continuing education course that was included as a hot topic on the DHHS newsletter this month. So we encourage you to check that out, really focusing on the transition to adulthood, highlighting some of of the amazing services with EIPD and NCDHHS. And next slide, please. As want to highlight addition to one of our alliances, Work Together NC Transportation Alliance. We have been meeting regularly over the past 4.5 years, really focusing on identifying the issues of transportation in North Carolina. And we'll be continuing this work in the future in collaboration with Inclusion Works and NCDHHS. Right now, we've been really highlighting some of our members and what they have been working on. And so one of our members is at East Carolina University. Dr. Ann Dickerson is an occupational therapist and has developed a tool that's been focused on helping individuals match with their transportation called mobilitymatch.net. It's going to be transforming to a new platform with hosts by East Carolina University, and we'll be sharing that as soon as it's available. Alongside that new resource, there'll be student-led created instructional video guides. So for things like the app setup, personal safety, and Uber navigation. And in addition, we're also working on our online library of transportation choices, really to maximize visibility for the Inclusion Works project. Right now, we have a downloadable transportation guide as well as resources available on the Work Together NC website that we're constantly adding new resources to and working on identifying more transportation choices as we move forward. Really wanting to hopefully over the next year focus on identifying documentations to help self-advocates figure out how they can communicate with their local public officials to impact change in their local communities that are surrounding transportation, since it can often be very location dependent and county specific. And also thinking about how to approach different kind of levels of contacts when public transit fails. And so who do you reach out to when you have an issue? And we encourage everyone who is interested in transportation to join us. Please reach out to Claire or Work Together NC to be included in the meeting invitation. The next meeting is August 11th at 1 p.m. and it is virtual. And next slide, I will be passing it back to or over to Catherine, who will be talking for the first time.
Hi, everyone. I'm Catherine Titus with WISE, and I'm so happy to be here and share the piece that WISE is working on in North Carolina as a part of the greater Inclusion Works happenings. And so part of that on the next slide is some information about how provider innovation is going so far. So it was exciting. Claire shared earlier all 12 of the providers who are now a part of the Provider Innovation Learning or project, and the round 1 providers have completed 4 of the 5 milestones, which has really been developing training and TA plans, getting some individualized by provider training opportunities in some WISE Pro learning sites in the WISE Learning Center, developing trainings for staff. We've got the round 2 providers who have just gotten started this month, and we had our welcome meeting earlier this month, and we are setting up, we've got some meetings set up for them to get started on their training and TA plans. So far, since October of 2025, some of the training and TA that has been provided has been around organizational change, future planning, communication tools for staff and others, job development, onboarding, employer perspective, family stories. And I think one really cool piece of the overall Inclusion Works project that's happening and with provider innovation is really increasing the provider collaboration and building, you've got a great network there that you're all probably aware of in terms of providers who you all are doing great work. And the goal, of course, is increasing the customized, individualized employment opportunities for folks. And so since January 1st of this year, there have been 8 new job starts, an additional job offer, and then 5 CIE temporary job opportunities. So that's 14 people who have had some expanded opportunity in the last 6 months with these providers who are part of Provider Innovation. So it's been really exciting how the providers helping individuals through the employment assessment piece that you heard about, and then how that then connects people to EIPD. And so it's really a great collaborative effort here. So the focus, of course, is jobs and expanding opportunity for folks in North Carolina with disabilities who may not have had the opportunity to have a lot of jobs yet. And so what might that look like? So we're pretty excited about that. And as a part of what WISE offers on the next slide is an image of the flyer for the WISE Online Academy 100 series. And then I think I noticed someone had put the flyer in the chat. This is offered to you through Inclusion Works free of charge. So when you register, it will automatically load the code, so you won't be asked for payment. But this is really a core competency ACRE certified training. So at the completion of the training, those of you who are staff will receive $100 from the state of North Carolina. Claire is working on that with everyone. Really want you to be appreciated and recognized that we know that this is a focused amount of training on top of the work that you're doing. And so the feedback has been really good about this. We know it's intense, but it's been really helpful. So the certification as an employment specialist or someone working for an agency, the certification stays with you. And it will then give you an opportunity to connect with others. We will be running a WISE Online Academy 100 series practicum coming up starting in a few months. And there will also be an opportunity. We have an Online Academy 200 series, which is a professional level certification through ACRE. And there are a few spots available for you all through the Inclusion Works work that we're doing. So be looking for a flyer if you have received your WISE Online Academy 100 series ACRE certification in a few months. It won't start till January. So in the fall, you can look for an opportunity. Space is limited, but you can look for an opportunity to apply for the 200 series as well. So it's just one more way that we are trying to make sure that we build capacity and get great training out to folks as you're looking within your agency at expanding what you can offer. So we're really excited for what's happening. And up next, Claire is going to share about some additional training available. So trying to make a lot available to folks and that can fit what everybody's needs.
Thank you, Catherine. And thank you to Brianne and Barbara and Adrian for the great work that everyone is doing in support of Inclusion Works. So we do want to talk a little bit more about some of the resources that are available. And on the next slide, I always want to make sure that people remember that this is an available resource that is just amazing to use. It's called Disability Benefits 101. We have a specific North Carolina version of this. We're very, very proud of it. It is incredibly helpful. Aside from transportation, we know that benefits and the possible loss of benefits because of work income is a huge concern for people in our state. And so, one of the ways that we are able to address this is to offer you this tool. This tool is very interactive, and you can put your information in, your personal specifics, how much you're currently making, how many hours you're working, what benefits do you receive, and how much. And then you can look at, so if I get this CIE job, which is now going to pay me, $12 an hour or more, and I'm going to work, let's say, 10 hours at that job, how does that impact my benefits? And it shows you how all of the different things break down. And then you're able to actually see how at the end of the month you still have your benefits, and you also may have more money in your bank account, and you have a job that you chose to work on. So it's a really, really effective tool. And in addition to Disability Benefits 101, we still have benefits counselors. More benefit counselors are being certified across the state every year, and we want to make sure that people have access to those. If you have concerns about being able to access those, please reach out to me. I really want to know. We are thinking about trying to find a way to have like maybe a database of benefit counselors that are available. But we definitely have decided to put more emphasis on this as we go forward, again, because it's one of the things that was identified for us in the landscape assessment, how much of a concern the potential loss of benefits can be for people, and it's part of our strategic plan to try to help some of that. So check this out. It's fun. I've played with it and put different numbers in just to see what it looks like. And it's very interesting, the answers you can get. Next slide. And just in addition, I want to always remind people, Catherine just talked about the WISE Online Academy series. This is a tremendous opportunity. I'm so happy that we can offer it again this year. In addition to this, we also have an e-learning course that is available through the State Employment Leadership Network, which is a nationwide group that we're lucky to be a part of here in North Carolina. If you're interested in this course is not as intensive as the Online Academy series, and you don't receive an ACRE certification, but the information is super helpful and it's incredibly interesting. If you're interested in getting into one of the courses for the e-learning modules, please just reach out to me and I will make sure that you get enrolled in the next section. North Carolina's APSE has tremendous resources for training. They are offered all the time. If you're not on their mailing list now, please get on there because they're doing a lot of work. Work Together NC continues to offer a variety of information. Go to their webpage, go to look at the toolkits, look at all of the different things that Work Together can offer. And we work real closely with, as you've seen, we work real closely with Work Together to make sure that we can support opportunities across the state. In the last several months, we were at NCARF out at Carolina Beach. It was a great conference, lots of people available to talk about specific issues that are surrounding employment for people with IDD. And we were also able to be at the I2I Center for Integrative Health conference. We have several more coming up where we'll be able to be there and be able to speak to folks. Next slide. And these are just some of the partners. These are the people we want to, emphasize that we are currently working with a lot of people from a lot of different organizations to try to see where the state can be helpful, where Inclusion Works can be helpful, and keeping track of the information and the tools and resources that are out there. And we want to make sure we always give you access to those. So one of these again is NCARF, Association of Rehab Facilities. I already mentioned APSE, Supportive Employment. This year we were able to help sponsor Path to Possibilities, which was a terrific resource summit that occurred in Chapel Hill. DECI, who happens to also be one of our grantees, held their first annual resource fair, which was the attendance was amazing, and it was really great to see so many people turn out, both to share information as well as people who were there to get information. And so we were happy to be a part of that. As I said, we were at the I2I Spring event, and we were also at the NC Division of Career Development and Training conference. Again, really talking to career development and transition, I believe. Talking to people who work in schools and people who work with kids who are going to be transitioning out, and making sure that they have access to the information that's out there and the resources that they might be able to tap into as they're transitioning out of an educational system. Coming soon, you're going to be able to see we have some new educational videos that are in the works. We have some new social media posts that Work Together is working on with Inclusion Works. Really tremendous stuff. And I want to point out, Brianne mentioned the Purple Bowl, and I can't say enough. I really thought that video was incredibly informative. So if you get a chance to see the Purple Bowl video about real-time, real-world inclusion in community employment, it's terrific. And then we also, as I said earlier, we are part of the State Employment Leadership Network, which is a network of states around the country that work on promoting employment for people with disabilities. So we're really happy to be part of all of those things. And if you know of a place where we might be helpful or influential or assist, please just, again, reach out to me and let me know. Next slide, please. Okay. This is a huge benefit that we have been able to do. Through Trillium Health Resources, they have developed something called the Ultimate Living Assistant. Currently, it's still called the Trillium Ultimate Living Assistant, but it is going to be changed to Technology Ultimate Living Assistant. And this is an incredible tool that people can use with a tablet that can actually be able to get real-time assistance when they need it. So as they live more independent and interdependent lives, making that technology be available to them so that needing an individual's help with something doesn't have to be a barrier. It can actually be available at your fingertips. And we're really excited to work with Tula, especially around the area of employment. You're going to see a lot more on this in the coming time. All of our provider innovation grantees are already taking advantage of this tool. It's just terrific. Please learn more. This link will get you there. And as I said, just really, really encouraging to show how we can use cutting edge, state of the art things to help people who want to work in North Carolina. Next slide. Okay. And as a reminder, always, please keep in touch with Inclusion Connects. Inclusion Connects takes so many of the things that are not work related that are important to people with disabilities in North Carolina. We want to make sure that people know that this resource is available. There is so much available on that webpage. There is a lot of work going on, again, in the direct support professional space, making sure that the people who are employed to work with people with disabilities have what they need to both prosper in their jobs and increase their capacity as talented professionals who are doing a very specific job. We want to make sure that people have access to housing. And one of the most important things I think that they're working on is interpersonal violence and keeping people safe. There is unfortunately still a tremendous amount of work that needs to be done to help people who might be vulnerable to violence. Next slide. Okay, so we have time for some questions. I'm really happy to be able to see how I can help you. So I don't see any questions yet in the question and answer pane, but take a minute and feel free to put your questions in there, and we'll be happy to answer them if we can. And just a reminder, if you don't have questions that you want to put in for discussion today, you again can always reach out to me with specifics. If you need help with something, I'm going to do my best to try to help you out. And as will the rest of the Inclusion Works team. And so if we don't have questions for today, then I am going to thank you all for coming. I appreciate your support. Oh, we do have a question. Yes, there will be a copy of this presentation, both the recording and the slides will be available on the Inclusion Works website. Thank you for asking that question. Very important. You're welcome. Ricky is asking, how will the new work guidelines impact individuals working now? Ricky, if you can come off mute and tell me a little bit about, because I want to make sure I'm understanding what you mean when you say new work guidelines. Would you might possibly mean,
Okay,
yeah,
can you hear me now?
I can hear you, Ricky.
Okay, with the new proposed work guidelines impacting particularly the extended Medicaid recipients that
Oh,
are
okay. I'm understanding now.
incapacitated.
You're talking about Medicaid. Okay.
Yeah,
I don't know if we have someone on. This is certainly an issue, Ricky, that we've all been talking about. Adrian, would you feel like you can come on here and talk about this at all? And if you can't, I understand. Ricky, what I will say is that we are all working really hard on making sure we understand all of the impacts that are out there. I see Adrian here. Adrian, would you like to answer Ricky?
Yeah, I can try. I do know, and I'm not the expert either. I think it would, Medicaid and social services would be a resource to help. But my understanding is that for individuals with disabilities, those exceptions would still be something that would be factored in terms of the work requirements. I think that would just be a discussion that you'd have to have with the Medicaid office if you feel like you're held to that work requirement. Yeah, I think it would be important to share that information if you have a disability or aren't able to meet those expectations.
And
gotcha. All right, thank you.
And I will say, Ricky, too, that this is an evolving issue. So as we go out, like I know just in the last month or so, there have been more communications coming out regarding those work guidelines. So I do want to say that as we learn more and as we understand more, we're going to make sure that we communicate as best as we can to the public. It's a really good question, and we're all trying to figure out what comes next. Thanks for asking it.
You're welcome. I'm a Region 4 CFAC under VIA, so it's important that we know how to try to help with those gaps and barriers.
100%. Thank you. Any other questions? Well, again, I thank everyone for coming. I know during the summer months, it's hard to make time for some of these meetings, and we really appreciate you showing up and your being here. And of course, we're all working together to try to make sure that we have as much access to employment as possible for those who want to work. Thank you, everyone, for coming, and have a great day and have a great rest of your summer.
The recording and presentation slides for today's event will be posted on the Inclusion Works website. The link is included in the chat. There will be a brief survey following today's webinar, and we would appreciate your time completing it. The next Inclusion Works Community Advisory Committee meeting will be Tuesday, October 20th at 11 a.m. This concludes our webinar for today. Thank you for attending.